So I'm going to introduce you to Dr. Colin Brown. He, like several others in the room, are our clinical ambassadors for the technology programme. Colin is a gastroenterologist from Morecambe Bay. Do you want that? Yeah. Have you not got a mic?
No.
Can
you hear?
Do you want this one? Yeah, have this. Have this. I think.
Everybody hear me okay? Okay. No, I'll do without. Okay. So thanks very much, everybody, and welcome to today. So this isn't part of it, don't tie me on this. But it is interesting looking at the future and building on evidence and research base. Anyone have any idea what the half-life of truth is? It's about 50 years. So it was reported in gastroenterology circles a few years ago that they scanned through BMJs and gut and publications to find out how long that research stood for. And it's about 50 years. So a key paper in the late 1930s went along the lines of, if you've got alcoholic cirrhosis, it's quite good to take alcohol because it makes you feel better. You say that isn't true,
Colin. That way at the screen. Yeah, go.
Press it.
Oh. Yay. Yeah. There.
Okay. So, reassuringly to me, some of the things I've got in my thoughts echo what's already been said, so that's actually a relief to me. But our challenges in Lancashire and Cumbria are to provide a great citizen and patient digital experience. We need to look for a great experience for our health and care workers. I think we need to design the front line, and I think that came through in a previous conversation. We need to converge, simplify. We need to co-design with our clinical and business colleagues new health and care pathways that involve a fair proportion of self-care and also involve the third sector. And actually, one of the things I think we need to do is we need to make it a bit easier and a bit more attractive for our area to be invested in as well. And I'll come to some thoughts on that. So if you look at computing power, come on in. So this is an old, almost pre-green screen computer that is a pygmy compared with what we've got today. But this little baby was on the mothership of Apollo 13, and it brought a broken down washing machine with 3 men alive back to Earth. Step forward 1989, this is an Alan Michael sugar trading computer that I used when I was doing research. It took me 20 minutes to print out a 1-page graph. And now we've got massive power in our pockets, and we need to leverage the value of that. In terms of great citizen and patient experiences, we need our citizens and our patients interested and involved and wanting to be involved in their own healthcare and their organisation, the organisations of healthcare. We need large amounts of people interested in being connected to GP records, but also, and being able to manipulate appointments to suit themselves, but also connecting with other hospital records and so on. We need citizens and patients to be involved in adapting their own care, managing themselves within guidance and within care plans and with appropriate escalations. And we need to take the value of patients and people doing their own measurements and inputting that data into records. We need to support digital conversations between patients and citizens and clinicians through message streams or remote VC. And we need to help support our colleagues to engineer out waste and unproductive stuff. Loads of patients come to hospitals for hospital appointments with no great value. We need to help engineer that out. For our frontline clinicians, we need to provide a really good computer desktop experience. And part of that is to be able to go into a good quality clinical system, an EPR system with single sign-on, and then inherit the value out of that to be able to navigate to other systems. We do not want to be going into 5 or 6 separate systems on the desktop. But we do want to use that host system, and it doesn't matter whether it's a hospital system or a GP system, to navigate through to other systems of value and of relevance to patient care. And we want to take value from clinical decision support. And that largely is through leveraging aggregated data from other systems, which then pop up in front of us when we've got patients there in our system. So here's an example of a hospital system. This is Lorenzo EPR, and what you can see here is that we've got a connection with the GP record through a button, and we can leverage information through that into the hospital clinic ward.
And I'm so sorry, I wasn't mic'd up, so if there's anyone out of the room that didn't hear me, apologies. On the internet. What's Tinternet? So we do need to look at identifying previously unrecognised disease. If we had automated systems that could automatically then trigger bookings for blood tests, recognise which blood tests were abnormal, and then automatically book the appointment with a clinical nurse specialist, that's even better. I think we need to make ourselves locally attractive to invest in. I just have a personal view. I don't think Cumbria and Lancashire has been equitably funded in the country. And for instance, in terms of doctor training posts, we're funded to about the 60% level compared with Manchester and Mersey, and that's known. I don't think we've particularly been invested in heavily digitally. We don't have local digital exemplars, and yet we are highly innovative. And we've supported a number of things which the great and the many have used for record sharing. So we were the first to use the make and get and send letters from Lorenzo EPR to EMIS Web EPR. We were the first to develop an EMIS Web community instance. We were the first to surface a GP record into a hospital EPR system. We invented the ISG gateway system that has been a massive enabler around the country, used by nearly 2,000 organisations, and the Cabinet Office are interested in this now. We invented advice and guidance, George Dingle there. We're the first to connect to the third sector. So we are a highly innovative bunch. So what do we need to do now? We need to progress from our agreed strategy at this point. We do need to develop an agreed delivery plan. Our system leaders are so important in achieving this and driving us to the right answer. The size of the prize will depend on some of the aligned decisions that we are able to make, and we need to look at levers and incentives. So, where's my schema? It's not there, but I did hope to show you an infographic with all of the different areas in terms of empowering citizens, empowering the front line, looking to sustainably manage systems and connectedness and so on. And what I would hope that you would agree with me is that we are meeting all of those areas in the strategy that we've had approved yesterday and are accepting today. So thank you very much.
Thank you. I do apologise for those people that are listening to us on the live stream. We hadn't realised that they were missing all of these fantastic things that you were sharing with the room, Colin. What fabulous stuff we've got going on across Lancashire and South Cumbria. Every single bit of our areas have something that they are championing and moving forward. And our job is to connect them so that we take the best from the Bay, the best from the Foul Coast and Pennine, West Lancs, and stitch those all together. Central Lancs, our health, our care. I'm getting the nod from Vicky there. Some brilliant stuff going on. I know we do have a couple of questions from Twitter, and before we go on the break, I want to tell you where we're going in terms of the workshops afterwards. So, has anybody got the questions that they wanted? Is it for Colin?
Paul has done a sterling job for me. James was on about culture change, and so there's patients, leadership professionals and staff. Where do volunteers figure in building a digital-ready workforce? So touches on, what Colin was saying about the third sector as well, but where do volunteers sit?
James wants to jump up and say something as well. And I hope...
Thank goodness for that.
And I hope what people are hearing in the room, that we are not just talking about those institutions that have served health and care across our system. It's our communities, it's our grassroots that are actually going to help us deliver on this. So volunteers and neighbourhoods, and enabling neighbourhoods to do for themselves is as much part of our strategy as digitising our secondary care providers. James obviously wants to say something.
As long as you don't mind.
No, gosh, don't go for it.
It's just that it sounded like it was for me to answer. So we live in a world of boundaries, don't we? And I think it was Dom who was basically saying, but we're all part of one health and care system. We are trying to we are pushing in the same direction. It's just sometimes our boundaries and sometimes the politics get in the way. And that's kind of where the silo thinking comes from, right? As much as possible, I would hope that not just the Building a Digital Ready Workforce programme, but all of our national programmes would support products and services that are open and are equally applicable to volunteers as they would be to carers. We've got 6 million carers in this country who are you could describe as part of the informal workforce, or indeed the wider public. There are some things that are absolutely geared towards people who we employ. And it's all down to the routes that you take and the things that are open to us as individuals, either as a member of a profession or a member of an organisation. But there is no principled reason why you'd want to exclude volunteers from any of our BDRW stuff, and we don't.
Yeah. Okay. I haven't formally thanked Colin, so thank you very much, Colin. So brilliantly, we are on time, and we have a breakout area there where there's coffee and tea being served and biscuits. I do need to say, go and have a nosy in there. We have got lots going on in a tiny little room, so again, we do apologise, but we don't apologise for the fact that you've been attracted to this event. You might experience a bit of the future, which is actually the now. We've got Dr. Amin over here and Steph, who have brought along their VR educational packages and that patients are already using across our patch. Have a look at our NHS orb that's set up out there. What an opportunity to take our public and our patients online. Go and have a nosy. Test beds, we're already a test bed. We're a 1.5 test bed. We want to be a test bed too. Go and have your say on that. Share your story, whether it's your story about your digital journey or your memory, your bestest memory of your time working within health and care, so we can capture those and get those out for people to hear. Enjoyed the break. Go on.
So just to add to that, I really encourage you to reach out to people in the room. There are many of you that we see that need to connect. So I know, Alistair, you need to talk to William about radiology and what they're doing over there. And there are many other things. Some of the work that Samra's doing in the Fylde Coast really would encourage you to reach out to the colleagues in the room. Because as we move into this afternoon session and the session after break, it's going to be all about creating our plan.
It is. So you might have noticed that you've got a coloured dot on your badge. If you haven't got one, then just come and see one of us and we'll sort out a room. We're using the Victoria room. If you've got a red dot, you will be in the Victoria room for the afternoon workshops. If you're in the green, I've got a green dot, you'll be in the green room, to make it simple. If you've got a yellow dot, you will be in this main room, over in that corner. And if you're in the blue group, you're over here. If I could just ask the facilitators to stand up. The red group will start with Sue and Dom, so give them a wave. That's the red group's first speaker. And the speakers will rotate around your rooms. You can stay in the same place for the rest of the morning. The green room, Veronica and Juliet will start in the green room. Sue Kennedy and Kath Sim will start in the yellow room, and Bruce and John Deffenbaugh will start in the blue room. Go and enjoy your coffee, and thanks very much.
Okay.